Today, we're breaking down what ELBW actually means in the NICU world and my top 3 foundational concepts for caring for this population. Hi everyone, I'm Ashley, founder of NICU Compass. After spending 10 years in the NICU, I realized that the hardest part of learning neonatal medicine isn't memorizing numbers and terms. It's understanding why those things matter. That's exactly what NICU Compass is here to help with. Let's dive in. Let's define the terms. ELBW, or extremely low birth weight infants, are defined as being less than 1,000 grams at birth. Another term you'll hear sometimes is VLBWs, which is very low birth weight infants, are less than 1,500 grams at birth. Infants of this size are incredibly fragile and require an entirely different kind of care than a full-term, big bouncing 8-pound infant. These infants weigh less than the water bottle you carry with you every day. On average, preemies born at 23 weeks are often around 500 grams, which equates to 1.1 pounds. Average household items that weigh 500 grams include a loaf of bread, a 500 milliliter bottle of water, or a large grapefruit. Compared to a full-term baby who averages 3,080 grams, which is 6.8 pounds at 38 weeks. With a weight so small comes incredible fragility requiring a delicate balance. The first step in helping these tiny patients start their new lives in the outside world is breathing. It's one of the first problems for ELBWs is their inability to breathe on their own. Babies born at 23 to 25 weeks usually require a breathing tube and a ventilator to breathe for them. They are intubated almost immediately after birth and will maintain the use of the breathing tube until they are a little bit bigger and old enough to maintain proper oxygenation on their own. This time frame is different for every baby depending on multiple factors of their health. If you had the chance to see an adult breathing tube in nursing school, brace yourself for the tiniest breathing tubes you've ever seen. ELBWs are often using a 2.5 or 3.0 size tube. We will discuss more on ventilators in another video though. The second foundational concept for caring for ELBWs is thermoregulation. With a weight as little as 1 pound, these babies need a controlled environment to regulate their body temperature as they don't have enough insulating body fat and have very thin skin. Therefore, we put them into fancy beds called isolettes or incubators. Inside their little homes, we can control the overall temperature inside the incubator and tell the bed itself to maintain baby's temperature, much like the thermostat in your home. By attaching a temperature probe to baby, the bed will read this temperature, then adjust the environment to help baby maintain normothermia. We want their temperature to be somewhere between 36.5 to 37.2 degrees Celsius, or 97.7 to 98.9 degrees Fahrenheit. For our ELBWs, there is also the component of humidity. Because their skin is so thin and fragile, if we solely heated their environment without providing humidity, they would suffer too much insensible water loss, leading to dehydration and further weight loss. Each NICU has a specific protocol on starting and then weaning off of humidity as they grow. Typically, babies don't need the humidity for very long, about 2 to 3 weeks, based on various protocols that I've seen. Luckily for us, though, the isolette controls that function as well. My last key point in introducing you to care for some of the toughest patients you will ever meet is gentle handling. It is important to remember that everything about them is fragile at this point. Their lungs, their brain, their eyes, and their skin. Handling these kiddos with gentle hands is so important. You will often be doing what we call their care time with a second nurse or an RT, respiratory therapist, especially if they are intubated. This is when we're doing all the things we need to do for them, our assessment, listening, changing their diaper, drawing labs, and repositioning baby. How you reposition an ELBW is extremely important, specifically their head position. Every NICU will have specific protocols about infants staying midline for their first 72 hours to sometimes up to a week to help prevent what we call intraventricular hemorrhages, or IVH. Think of the veins draining from the brain like soft, flexible garden hoses. Turning the baby's head too far to one side can partially compress the jugular veins in the neck, making it harder for blood to drain from the brain. This can increase the pressure in the fragile blood vessels of the brain, making them more likely to bleed. Better venous drainage may help reduce fluctuations in intracranial pressure, which are associated with higher risks of IVH. IVH has various levels of severity, but can lead to mild to severe developmental delays later in life. It is our job to do our best to protect and preserve the life and quality of life of our tiny patients. While there is so much more to talk about for our ELBW patients, these are my top 3 points to remember when caring for our smallest population. Protect their airway, keep them warm, and handle them with care. If this video helps something click for you, subscribe to NICU Compass. Every week we'll break down another neonatal concept into something that's easy to understand so you can build your knowledge, confidence, and provide better care for our tiny patients. See you in the next video.